There we go. Okay, so let's start it that way. So let's begin. So as stated, the webinar is entitled Virtual Collaboration Tool from the BC Support Unit. Specifically, we will be going over our electronic communities of practice, also known as eCops. So now let me give you a bit of background information on the people that are in charge of eCops in our organization. So we have Pat Atherton, who's responsible for training and capacity development and our virtual platform of eCops. She's been working in the virtual work environments in health research since 2005. And you have myself, Belinda Jampo. I am a project coordinator of provincial initiatives, and this includes supporting eCops and training in their use. So we'll begin by giving you a little bit of background information on our organization. So let's begin with a bit of knowledge on SPORE. So what is SPORE? SPORE stands for Strategy for Patient-Oriented Research. Now, this is a national initiative led by the Canadian Institutes of Health Research. And it's intended to improve health outcomes and enhance patients' healthcare experiences by integrating research evidence at all levels in the healthcare system. So we know what SPORE is. What is PORE specifically, which stands for Patient-Oriented Research. Now, PORE is research that is done in partnerships with patients, and it also aims to answer research questions that matter to the patients, and it aims to improve the healthcare overall. So who are our PORE stakeholders? We have our patients, researchers, healthcare providers, and healthcare decision makers. So we have all of these individuals at varying roles that could very well be in different parts of the province. How do we connect them? And this can be challenging. So this is essentially what our eCops tends to do. It tends to eliminate that obstacle. So I'm now going to pass it over to Pat to go over eCops specifically.
Thank you, Belinda. That provides a nice little piece of context for why eCops are important in the province of British Columbia. We are a diverse province filled with rivers and mountains and institutions that have firewalls. We're trying to bridge across all of that geography and those institutions, as well as the different disciplines that are involved in health research and in patient-oriented research. So the BC Support Unit has this fairly significant challenge. How do we bring all of those people together? Well, we looked back at a previous grant program that was funded 2009 to 2016 through the Michael Smith Foundation for Health Research's Nursing Research Initiative. They funded a program called InspireNet, which was BC's Health Services Researching Network, and it was mandated to grow research in nursing for nurses to produce research and for nurses to take up research at the bedside. I worked for InspireNet at that time, and when we were first launching that network, we realized that we had 42,000 nurses in the province of British Columbia. And we thought, how do we connect all of these people across this great province of ours? And we've reflected back on a previous grant program funded through Michael Smith Foundation called the Health of Population Research Network. And it had a similar mandate, bringing together like-minded people. So those two projects evolved the concept of electronic communities of practice. And we based the idea of electronic communities of practice, or eCops, on the literature and on what others were doing globally. There was no similar capacity in the province of British Columbia at the time, and there isn't now still. So by the wind down of InspireNet, when its grant was folding in 2016, we had 4,200 people using electronic communities of practice in 80 discrete communities. So you can see that we had pretty significant uptake from the nursing community in the province. So InspireNet developed and launched a Web 2.0 website, including eCops as part of this virtual community. We evaluated eCops effectiveness through a series of surveys, focus groups, and interviews, and we published our findings. And on the previous slide, you have seen a document that related to that effectiveness measurement, and that is up on the Michael Smith Foundation's website. We also studied eCops using the published literature on communities of practice to determine what the best practices were for communities who had a specific problem or issue to address. From all of that, we created the InspireNet communities of practice. And we continue to refine them as we learn more through that work, through those surveys, interviews, focus groups, and the review of the literature on what was going on elsewhere. So by the end of 2016, we had a pretty robust understanding of how you can bring people together virtually. And we had a provincial asset, these eCops that existed on a website. We know how to use them. We know that when the BC Support Unit launches, it's going to have a lot of research teams that are looking for a similar solution. How does a researcher bring together a disparate group of the 4 stakeholder groups? Again, those are researchers, patients, healthcare providers, and health system decision makers. How does a researcher bring that group of people together across the province without huge money for traveling to a specific site where the research team can get together to do their work? So the BC Support Unit then adopted the InspireNet model and leveraged it to create its own website with its own patient-oriented research eCoP. Now, I'm sure you're asking, what are these eCops anyway? Well, they're password-protected spaces on the BC Support Unit's Canadian-hosted website. The Canadian host is important in health research circles because of the far-reaching implications of the U.S. Patriot Act. So Canadian researchers typically like to have their data stored on Canadian servers, and our website is. eCops are easy to use. They are accessible only to team members, akin to a SharePoint site. So if you're familiar with SharePoint, you know that you can set up a SharePoint site and only those who have a password can access it. Same with our website. So we've got this website that's available to the whole world, but then we have these eCops that are available just to team members within that eCop. Anyone with a website account can contribute to the eCop, so you don't have to have any special software or any special training. It's kind of like social media, kind of compare it to Twitter or Facebook. It's very simple to use, and you don't need any special software. eCops allow for asynchronous participation, and that is so critical when you're working in a geographically distributed research team or a disciplinarily distributed research team where not everybody can come to a meeting at 10:30 on a Wednesday morning. With patient partners, for instance, patients can be working full-time and contributing to a research team after hours, or clinicians typically work shift work, and then researchers work 24 hours a day, and health system decision makers typically work more of an office hour time of day. So trying to line up those schedules means that getting a research team all together at the same time is really challenging. So an eCoP provides a way for everybody to have all of their content in one place, to be able to access it, and to be able to discuss it asynchronously, or not all at the same time or in real time. An eCoP also provides a one-stop shop for all project materials and discussions. So this is linked to that no more email attachments below, where you're all familiar with the conundrum of trying to find the right email attachment. If you've worked on a research project, you know that that document that we had 6 months ago that Jane wrote is somewhere in my email here, but is it this one, or is it the one that's dated 5 months ago, or is it the one that's dated 4 months ago? And you struggle with version control, and you struggle with trying to find the right email attachment. Where with a space on a website, you know that everything that's there is the most up-to-date, it's dated, it's all in one place, and you're not going to miss it. So you've got a one-stop shop for not only your documents, but also for your discussions, and you're not struggling with the email challenges that we all face every day. And a big piece for research teams is that, and I alluded to this earlier, eCops reduce the need for travel budgets and remove barriers for participation for all stakeholders. So again, if you've got a patient partner in, I'm going to pick on the north, let's say Terrace, who can't afford the time to fly to Prince George or even to Vancouver to participate in research team meetings, they're able to participate through an electronic community of practice at their own leisure, from their own home, without having to leave their place, without having to find time or find the energy to participate. And that's true for everybody. You know, it's difficult to bring a research team together across any geography, but BC is especially challenging to work on a project for a long period of time. Research projects don't happen quickly, they're slow, and that means typically a lot of travel, even if it's within one city. So here on the Lower Mainland, for instance, you could have a research team that's spread across all the Lower Mainland, and it can take 2 hours to get from one corner of Vancouver to the Metro Vancouver to the other corner of Metro Vancouver. So with an eCoP, you have the capacity to collaborate without those barriers. So what do eCoPs provide? I've told you that they're password protected spaces on our website. What does that mean? Well, each eCoP has these pieces of functionality for a team to use. They have news, discussions, wikis, resources, and a list of people. We currently have 48 eCoPs in use in the BC Support Units, on the BC Support Units website. And I'm going to drill down and show you what each of those pieces of functionality looks like. In real life, we're going to take a look at our website. I think that's the next slide, is it not?
Oh, is it? Okay, yeah.
Oh, I just want to talk about this if I can.
Oh, yes, of course.
So this is a quick little overview of the actual real-life eCoP I'm going to take you to. So this is the Poor Pathways Project, which is a research project underway here at the BC Support Unit, and it is a real-world example of a real-world research team. We have operated for the past over 2 years. We've operated across 2 provinces, and one of our team members was on sabbatical and was traveling around Europe. We are multiple disciplines, and we are 9 people strong. So you can imagine, just wrapping your head around that, how this might be a challenging project to undertake when you've got people on the move, people across provinces, multiple people, and multiple years. The intent of our project was to complete a scoping review of thousands of articles. I know that number is 2,400 articles. And lines of data, and I don't know how many lines of data there were. There were many, 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 related to core competencies. So those are the skills, knowledge, and attitudes required to enact patient-oriented research. So we were looking at what the published literature says about those competencies. We used an eCoP to collect all of that information, and we supplemented that by using web conferencing to bring our group together in monthly meetings. Across the course of the 2+ years, our team has met face-to-face just once for an all-day working session, and otherwise our entire project has been carried out virtually using an eCoP and web conferencing. Now if we can go over to the website, I will navigate you through what that eCoP looks like. And while Belinda's getting us organized, I'm just going to check in and see if there are any questions at this point. And I think you need to use the chat at this point if there are any questions. The first tab. Seeing none, then we will press on. All right, so this is the BC Support Unit website, and I'm sorry, I'm the administrator for the website, or one of the administrators, so you see all of this back-end noise at the top. Just block that out of your mind. It's not really there. What we're looking at is I'm logged in. You can see because my smiling face is in the top right-hand corner, and I'm logged into one eCoP. It's private, and it's for the Poor Pathways Project. And by private, we mean that only those who have access to this eCoP are able to get into it, and those are our team members. So any team can set up an eCoP that's specific for its team members to be able to access. This is the home page of the eCoP, and we've set up a series of quick links here so that the research team, 2 years out, so we started this work way back in 2017, I think. It's difficult to remember what we did in 2017, but fortunately we've got everything here in one place. We've used a series of Google documents to track our data. We've extracted our data using another Google Doc. We've created some Word docs, and they're all here. We've got all of our planning documents, our meeting notes and recordings, background documents from CIHR related to what core competencies are, compiled Greylit and other projects that are related to our project, Alberta had done some competencies work, so we've linked to theirs. We've got a group of advisors who have been helping us with this work, and we've got a link to their content all in one place. And Alberta did a scoping review, so we've got a link here that relates to that. We also have a discussion forum, and I'll drill down into that in a minute. So this top section is just kind of the high level. A team member can come here and find everything they need with the click of a button. Then we broke down the work into phases. This is the lit review phase. So as the project unfolded, we just kept adding to the eCoP and adding links to all of that content here so that team members can see the project unfold and go back and find things over the course of time. We've got the literature search plan and reports. We've got our abstract review, full text review, and data extraction Google Doc located in this section, and links to our GREE-Lit. And then as we pulled apart all of the competencies source documents, we synthesized that data and we put it together into a series of documents that are available here, easy access on the eCoP. And finally, we started to disseminate our learning. So we completed a scoping review manuscript and submitted that for publication. It's now been published. The protocol, I should say, has been published. And we have a number of other pieces of dissemination of our project. And we also have a schedule of our meetings available for the team. And I'm going to take us to the discussion forum so you can see how that works. So this is a high-level kind of go-to place for every research team member to be able to go and find their content in one place. I'm going to take us to the discussion forum. So this is for our asynchronous conversation. I mentioned that one of our team members was in Europe. This is not moving. There we go. Just clicking a link here, it's taking a moment to load, as you can see from that really gig at the top. Just a little bit pokey today. So this is the very first post in our first discussion forum, and you can see it's time-stamped, posted by me, and it's time-stamped February 2nd, 2017. So that was the very first post of one of 145 posts in our discussion forum. And this is how our team kept organized. So I talk about a conversation I had with somebody at CIHR. I talk about a new team member. I tell the team, hey, you guys need to go do something. One of our team members has a very good trip to Greece, thank you. So Anastasia Maladou, who's a researcher at the University of Victoria, was in Europe as she was participating on this team, and she was able to chime in 3:35 Vancouver time. I don't know what time that was in Greece, but I can guarantee you it was not regular office hours. So she was able to participate at a time that was convenient for her and keep us organized with what she was doing without emailing back and forth. So the conversation continues. You can see farther on, there are more posts from other team members. Noreen Frisch is the lead of this project, so she's just raising a thought. I see Pat's comments about apparent differences, etc. So she's just talking about an idea she's having. Martha McLeod, who's a researcher at the University of Northern BC, likewise, she's talking about something that's happening in the project. So this is really just a conversation happening across a research team using an electronic platform where there's no need to play telephone tag or email chains back and forth. We've got everything in one place. And how this becomes really valuable is later on, as you're closing the project, and you're trying to remember what was that decision we made anyway, and whose idea was it? It's all here in one thread. So using the handy search trick of pressing the control button and pressing the F key on any website, you can search on text and find where something may have been mentioned in a discussion forum. And that takes you back to the day it was posted and who posted it. So you're not scrambling through the email attachment pickle that we often find ourselves in. It's all here in one place and it's flat. You can go find things in one flat piece of paper style. So that is the discussion piece of the functionality of the eCoP. We haven't used the news function, so I'm just going to jump right over it. Our web developer added that as a piece of functionality to our eCoP, and I haven't seen anybody use it yet. What it would do, if a team wanted to, is alert team members to new news, but nobody's used it yet, so I'm not going to drill down into that. We've taken a quick look at the discussion forum for this team and how that worked. Take a look at wikis, and before I click that, I'm just going to explain what a wiki is, because I get asked that question a lot. A wiki is akin to, if you think about Wikipedia is a giant wiki. So it's a space on the internet where anybody who has permission can edit that web page. So with Wikipedia, anyone who wants to can edit a Wikipedia entry, provided they have the privileges or the rights to get into that website and edit that content. Wikis across the internet are the same. They're editable by anyone. So I'm just going to click the wiki link. So I use a wiki for meeting notes. I'm just going to pop this open and you can see how we use that. So the date, the meeting, typically the meeting is recorded, and I include the recording link here. And then I just quickly record the meeting notes from the meeting. And again, this is the same notion for going back to find content as with the discussion forum, where you can use Control F and look through all the meeting notes all at once. They're not Word documents attached to emails, trying to scramble through those, trying to find out when did we make that decision, how was it made, what were the pieces that led to that decision. It's all in one place in a wiki, and anybody can go find it. The other advantage to doing meeting notes this way, and meeting notes is just one application of a wiki, but the other advantage is anybody can edit the meeting notes. So if you have on a research team a volunteer who's recording your meeting notes and they haven't recorded things exactly as somebody wanted them to be recorded, team members can go in and edit them themselves so that they're a stronger reflection of what was actually decided. So it becomes a more democratic way of working together and in collaborating virtually. And then resources is another piece of functionality, and it is the capacity for anyone who can access your eCoP to add resources. And those can be either attachments, like an email attachment, or a link on the web using a URL. So we'll take a look. We've got a lot of resources here because this project has been fairly detailed. These are documents. You can see all of these are labeled documents. You can also upload videos, and you can upload, like I say, links to the internet, and they all get saved in one place. So if somebody on your team is trying to find something, again, they're not scrambling with email attachments. They're able to find everything in one place here, one-stop shopping. And because this is the World Wide Web, all of these can be, we've got some background noise. If you could mute yourself if you're newly joined us. All of these are hypertextable. So that means that any one of these pieces of content can be linked in the eCoP. I'm just going to go find where we're getting that back from. Right. Sorry, everybody. So any of these pieces of content can be hyperlinked, like we saw back at that home page. So I'm just going to take us back to the home page here. Each of these, no, not those are Google Docs. All of these are hyperlinks to content within the eCoP. So we've uploaded the content and then created hyperlinks, so they're super easy to find for a busy researcher who's working on multiple projects with multiple people. Everything is here and easily accessible with the click of a link. So as we're winding down this project, I've found the researchers who are involved, because they are working on multiple projects, have said, where is that Google Doc that we were working on? And I'm able to point them here. Everything is all right here. So even though we're going back retrospectively and trying to find content that we developed in 2017, 2018, we don't have to remember where we stored it or what we called it or where it was. It's all here in one place. So it creates a tidy way to bring everything together and to make it easily accessible for everyone on the team, again, without travel, which is a super great benefit. And the last piece of the functionality of the eCoP is you can see what people are involved in your team. So this is not really valuable for a team this size, but if you were to have a really, really big team, it helps to see who's there, and you can click on their profile and see how they fit into the health research scheme of things. You can also access their email address if you want to send them a private email. And of course, you can use that discussion forum if you want to send everybody one email. You don't have to keep track of everybody's email addresses. You can just use the discussion forum to broadcast out to your entire team. Anyone on the team can send that to anyone else on the team. So that's an overview of eCoPs. And I'm going to give the presenter most back to Belinda.
So now that you've learned about eCoP, so what now is probably the question that you're asking, I'm sure. So if you would like an eCoP, all you have to do is just to contact me at bjampo@bcsupportunit.ca. You just have to provide the name of your eCoP and the names and email addresses of your team members. So I would then go into the website, create the eCoP, and establish those individuals on our website and put them in the eCoP so they're part of your team. We also do offer 1-hour training done via webinar with Pat and myself, if your team is also interested to know the ins and outs of how to operate your specific eCoP. So that is pretty much it for us. Thank you guys for joining us today.
Are there any questions?
Yes, let's move on to the questions. I'm sure you guys have loads. So we'll go back into our screen, and you guys will be able to now share your questions. So I'm going to unmute everybody, and I'm going to open up the chat box to see if we have anything as well. Do we have any questions? Comments work as well.
I have a question. Can I ask a question?
Yes, we'll just introduce, we've got two, I should have done this earlier on, sorry. We've got two support unit staff members in our small boardroom with us. One is Larry Mraz, who's research navigator and patient engagement liaison for the Vancouver Regional Center at the BC Brain, and the other is Justin Addison. Justin, I don't think you can be seen anymore. Put your head in. There's Justin, who's in the room with us. He's our communication specialist with it. And Dr. Mraz apparently has a question. So, Larry, what would that be?
So you had mentioned that you could link to a document.
Yes.
So the document has to be uploaded as a resource first?
That's right, yeah.
So how do you link to that document?
Unless the document is uploaded somewhere else on the internet and it has a URL.
Then
so
you
what
could
you need is that URL, and then you can use that to...
I see. You can link either to an external or to the
That's correct.
resources.
Yes.
You said it's not difficult to do.
It is, you may recall, you were a gentleman of an age, and you may recall a time before you knew how to use Microsoft Word. And now you can use Microsoft Word like that.
Yes.
It's like that. We're just at the tip of the iceberg in terms of linking things, and the kids today, they can link things in Word, no problem. Belinda,
So I have to
do you know how to link
Belinda
something in Word?
I think I can manage.
Yeah. So it's a very, very simple and straightforward activity. It's just learning how to do it.
Are there instructions on there? Like if you went to the website now?
That's a training. What Belinda and I would help with.
Would help with that.
Mm-hmm. I'm willing to bet that a lot of users will be able to link with the training. It would be like teaching somebody to use Word. Are there other questions? I hear none then. I believe this webinar is complete, Belinda.
Well, thank you guys for joining us. If you do have any questions as well, you can find both of our contacts, I believe, on our website, so you can shoot us an email, and we'll do our best to answer those. So thanks, guys.
Thank you, Belinda.
I think we might have a question, a last-minute question here.
Thank you.
Just a thank you. You were welcome.
You're welcome, Selena. Thanks for joining us in Calgary.
Okay, bye, guys.